Imagine that your whole body was covered in raised scars, or that you itched profusely from the inside out. Imagine that you had a yellow pigment to your skin that people questioned you about, or that you hunched over in pain all the time. These are just a few of the problems that Alagille sufferers have to endure. For every 100,000 people that are born in the U.S., one has Alagille syndrome. The purpose of this speech is to bring awareness to what Alagille syndrome is and a couple of problems it can cause in the body. Many people know about disorders such as DiGeorge syndrome, Down syndrome, and HDR, but has anyone ever heard about Alagille syndrome? 2 of my nephews have this rare disease, which is what prompted me to research it and to take interest in it. Alagille syndrome is a genetic disease that can cause many problems throughout the body. I'd like to talk about 3 specifically: the appearance of xanthomas and what they cause and what causes them, liver damage, and kidney damage. People with Alagille syndrome suffer xanthomas. These appear as raised scars all throughout the body, and the cases can be mild to very severe. They are a buildup of cholesterol that is migrated to the skin. Their Alagille syndrome causes extremely high cholesterol, so high that it can threaten a person's life. Emmerich and Whittington state in their journal, Alagille syndrome causes intractable pruritus and disfiguring xanthomas because of the retained bile acids and cholesterol. Xanthomas play an important role in their survival because by it migrating to the skin, it doesn't travel to their brains to block the flow of oxygen. While the appearance is not very pretty to the outside world, they mean life for the person who carries them. Liver damage is also among one of the things that they suffer from. My little nephew, Vincent, is 2 years old, and he suffers from severe liver damage and has xanthomas all over his body. They're often jaundiced, very yellow in color, due to the high levels of bilirubin. According to Zhu and his colleagues, cholestasis in patients with Alagille may develop within 30 days after birth and can aggravate into the liver cirrhosis during the following months or years. He itches all over from the high levels of bilirubin in his body, and his mom describes the itching sensation as like burning, itching from the inside out. Topical creams and ointments don't do him any justice. He's in line for a liver transplant, and this will regulate his color and bring him back to a more normal appearance, and the xanthomas will diminish as they're linked together. Now that I've explained the liver damage to you all, I'd like to talk about the kidneys. Alagille syndrome has a lot of renal dysfunction in the body. My other nephew, Vincent's brother, was born with polycystic kidneys. When he was just 5 weeks old, he got a UTI from the polycystic kidneys, and he had to be revived because his body went septic. After 2 weeks in the hospital, he did recover, but surgeons do not perform transplants until the age of 11. Until then, my sweet nephew has to subdue his pain with medication once he's old enough to even take medication to subdue the pain from the multiple cysts on his kidneys. To conclude, I've informed you all a little about what Alagille syndrome is. We've talked about the dysfunction it causes in the body, the xanthomas and what causes them, liver damage, and kidney damage. It comes to show that we cannot judge what a person is going through by their appearance alone. There's a quote by Khalil Gibran that says, "Out of suffering have emerged the strongest souls. The most massive characters are seared with scars." Everyone is suffering a battle nobody knows about, and today I would like to be a voice for the individuals that are suffering Alagille syndrome.